Today we will be covering adult attention deficit hyperactivity disorder and its evaluation and management. Adult ADHD prevalence is just under 3%. Prospective studies show that 90% of adults who meet ADHD criteria did not have childhood ADHD symptoms. Most children with ADHD do not experience symptoms in adulthood. Comorbidities in adult ADHD is common, with half of adults with ADHD also having other psychiatric or substance use disorders. Common comorbidities include mood disorders, anxiety disorders, and, as mentioned, substance use disorders. The diagnosis is based on a clinical interview and not by neuropsychological testing. Inattention is a symptom and not a disease. It can be caused by many things. One would want to screen for mood disorders, and in particular cannabis use. Screeners generally are not helpful for diagnosing adult ADHD as most patients will screen positively on these instruments. Symptoms must occur before 12 years of age, and childhood medical records are ideal but often unattainable. Functional impairment must occur across different domains, and it should be mentioned that procrastination is not a disorder. If help is needed to clarify the diagnosis in select cases, neuropsychological testing can be helpful. The treatment of adult ADHD should be focused on managing underlying mood and anxiety disorders. Motivational interviewing can be very helpful in decreasing cannabis use, and cognitive behavioral therapy has very good evidence for the treatment of ADHD symptoms. With regards to medications, the use of amphetamines and its risks are often underappreciated. It has been shown that amphetamines are associated with increased neurotoxicity in tissue cultures and small mammals. Limited safety data in humans long term are available, with the mean length of amphetamine studies being just over 5 weeks long. A 2023 study in JAMA Psychiatry found an association between ADHD drug exposure and cardiovascular issues. Alternatives to amphetamines are atomoxetine and bupropion, with bupropion being used off-label for adult inattention. When prescribing any ADHD medication, it could be helpful to keep it time-limited, considering the risks mentioned before. In conclusion, adult ADHD is a complex condition with significant comorbidities. The accurate diagnosis requires a careful clinical approach and consideration of childhood history. The effective treatment involves managing comorbidities, using cognitive behavioral therapy, and carefully considering medication options along with their risks. Thank you very much.